Hello, this is Ruth from Soft Touch Chiropractic, and today we're talking about what is degenerative joint disease or DJD. How does it develop in the discs of the vertebra? What are its symptoms? And most importantly, how to prevent it or help reverse it if you've caught it in time. DJD of the vertebral discs is also known more specifically as degenerative disc disease or DDD. So what is DJD? DJD is the slow deterioration of the disc and bones in the vertebra. The discs lose their integrity or they bulge. When they bulge, they press on the nerves that run along the vertebra that causes what we call a subluxation. So how does DJD develop? First, we'll give you a little biology background. You may already know that every cell in our body requires oxygen and glucose as a nutrient in order to stay alive. Cells also need to get rid of the carbon dioxide and other toxins they produce. In this animation, the red tube at the top is a blood vessel, and the green tube at the bottom represents the lymphatic system, which carries away cell toxins. The blue bubbles represent water. The blue bubble with two red bubbles represents carbon dioxide, which is the cell's waste product. The larger structure is glucose, or food for the cell, which is being brought in by the blood vessel. The triangular structure going from the cell to the lymphatic vessel is toxicity created by the cell. These functions happen all over the body, obviously, and you'll notice that all these functions happen in the presence of a blood vessel. Now, if you take a close look at a disc, you will see that there are very few blood vessels. Those cells in the middle of the disc still need oxygen and glucose, and they also need to get rid of their carbon dioxide and other toxins. So how is it possible for the cells in that disc to stay alive where there are no blood vessels? The answer is that these functions are possible in the disc through movement of the spine. There is a liquid substance in the middle of the disc called the disc matrix. The matrix is responsible for carrying food to the cells and carrying waste out of the cells in the absence of blood vessels. If there is no movement in the discs, the matrix remains stagnant and it cannot function properly. The toxins slowly accumulate in the disc, then the very center will slowly deteriorate. It starts losing its integrity, then the disc bulges. The bulge presses on the nerve. Then the nerve function and coordination, as well as the brain's ability to communicate with the rest of the body, is also interrupted. So here are the symptoms of DJD. Have you ever noticed that some people develop a bit of a hump on their back? Or maybe that they have lost some height? Those are symptoms of DJD. When a disc begins to degenerate and lose its integrity, it begins to get smaller or thinner. So if every disc in a spine loses some of its thickness, that will amount to a noticeable loss in a person's height. Other symptoms may include inexplicable maladies or illnesses because of the interference to the nerves caused by the bulging disc. One common symptom of DJD is back pain, and that may mean that a disc is already bulging. The pain will begin at the site of the bulging disc, radiating down to one leg, down to the knee, and sometimes all the way down to the ankle. Now, this is important that you know and understand. Everything in your body is controlled and coordinated by the nervous system. So the nervous system is your body's communication network and function coordinator for the organs and systems of your body. Let me give you an oversimplified example. When you eat food, the brain causes the functions of the stomach and intestines to be increased and other functions in the body to be decreased. The brain also causes different enzymes to be produced for the digestion of food. When your brain detects that you've had enough food, it produces hormones to signal you that you're satisfied. All the while, your brain is busy coordinating your organs, enzymes, hormones to successfully digest the food. So if there's anything interrupting the communication between the brain and the gastrointestinal system, something is bound to go wrong. So a real-life example of how a bulging disc can create dis-ease would be if you have had chronic constipation or digestion problems for a time. What might be happening is that there is interference between your brain and your large intestine. So if you came to the chiropractor with this problem, he or she might check to see that there is an interference or subluxation in your lower back at the level where the nerves go from the brain to your large intestine, in this case L3, L4, and L5. Now what I'm going to explain to you right now is of vital importance, so please listen up. A person may experience illness or discomfort caused by a bulging or degenerating disc without having back pain. So pain is not the first symptom of DJD, it's actually the last. So it is possible that a person already has DJD but doesn't know it, which is why it's so important that you see your chiropractor regularly and talk about not only your back pain but also any other abnormalities in your body. For example, gastrointestinal issues, headaches, insomnia, anger issues, anything at all. Please visit your chiropractor before you have back pain. Now we've already mentioned your nervous system is connected to every part of your body. So if anything interferes with it, the communication between the brain and the organs and other parts of the body is interrupted, therefore causing disease. When the communication is interrupted, the organs may work too much or too little. So the job of a chiropractor is primarily to remove any interference in the nervous system to keep your body healthy. That is why aligning your back and creating motion in your vertebra and the rest of your body's joints is so important. So that brings us to how to prevent DJD or help reverse DJD. The best thing you can do for your health is to prevent DJD altogether. You can prevent it by getting regular chiropractic adjustments. You see, the job of a chiropractor is to produce motion in the joints. With the adjustment, the vertebrae are being aligned back to their appropriate position to relieve the pressure of the nerves. By doing this, creates motion in the joints, and when there is motions, all those reactions that we talked about before start happening properly. If you already have DJD and have pain, the best thing to do is to get to your chiropractor right away and find out if the condition can be reversed. Again, when motion is created in the discs, you can bring nutrients to the disc, help it get rid of the toxins, and depending on how far along the condition is, hopefully reverse it and prevent it from getting worse. If you wait until you have pain to prevent this condition, it may be too late. So we strongly urge you to call us or call your chiropractor before the complete degeneration and fusion of the joints, because at that point there's very little that a chiropractor can do for a patient. The bigger picture here is that we want to maintain the integrity of the joints, especially the vertebra, so that they do not bulge. We don't want anything to interfere with your overall health, which is in the nervous system, because as you know, the nervous system controls and coordinates everything in your body. So preventing DJD will not only maintain your posture and height through your later years, it will save your health. Thank you for listening to us today. Please call us today to schedule your free exam and begin restoring your joint health. We ask that you share this video and leave your comments, and if you have any questions, please call us at 818-831-0100 or email us at askdrmasood@yahoo.com. And in the words of Dr. Masood, have a great and healthy day.